So good evening all. My name is Arya Anand. I'm one of the admin panel members in Edu Skills International. So Edu Skills International is a free platform. We are not charging money for any of our services. So please share to your friends so that they will get OET training without paying the fees. Okay. So today we are discussing regarding reading part A. Before moving further, I'd like to thank for the Saleen Joseph, all admin panel members and all the empowering members for all the support. So welcome to Edu Skills International free OET services. Today we are discussing regarding reading part A. So on reading part, not only in the reading part, okay, the grade is like A, B, C plus C, D, E. But we are focusing only on A grade. It's 450 to 500. Then B grade means 350 to 440. So we need to focus only on A grade. So we can score at least above 400. So in reading part A, we have 20 questions. Okay. At least you need to score 18 marks in your reading part A to get A grade. And our greatest mistake is we are targeting grade B. That means 350 score. So we will end up with the 340, 330, 320 and so always 450 to 500 in your mind. Okay. Then we have in reading part A, we have 4 text. Okay. Text A, text B, text C, and text D. And we have 20 questions and you need to complete your 20 questions within 15 minutes time. Okay. And the greatest challenge or enemy is time because we have only 15 minutes and we need to complete 20 questions. Then in reading part A, we need to follow expeditious or fast reading task. That means we are not reading completely. We are just skimming the text and we are finding out the answers. In Edu Skills, we will teach you how to complete your reading part A in 10 minutes, not in 15 minutes, in 10 to 12 minutes. And the 3 minutes time for checking your answers, checking your spellings. Because in reading, if there is a spelling mistake, then that answer they will consider as a wrong answer. Okay, so always check your answers. Check the spelling, okay? So tip 1, begin with skim. Then tip 2, focus of each text. I'll tell you how to skim, okay? So focus of each text, then skim. I told you, you need to begin with a skim. So what are the things you need to focus, okay? So first one is title. You will have a title that you have to read. Then section headings, subheadings, names. Names means any name, okay? If it is a body part, symptom, disease condition, whatever it is, okay? The names, then number or percentage, sequential expressions, frequency expressions, scale, adjectives, negative expression, and abbreviations. Hope you know all this clues because we have discussed many times regarding this, okay? Sequential expression, frequency expression like firstly, secondly, okay? All those. Then scale, most, majority, all, most, majority, okay? That and all, a few. These are some scale expressions. So for the details, you can just watch the videos, okay? The previous videos will get an idea. The 12 steps to crack reading part A in 10 minutes, okay? Identify 4 text heading and write down on a piece of paper. That means you need to skim the text and you need to write the heading, okay? Understand the relationship and sequence among the 4 text headings. Skim the 4 text, highlight the clues, okay? These are the clues you need to highlight. Read the question statement and highlight the hedging word. I'll tell you in detail how to do that, okay? Read the question statement and match the text. First, you need to read the question, then you need to highlight the hedging word. Then read the question statement and match the text, okay? Write down the hedge. This 6th step to you cannot do in your exam, but while you are practicing, please do this, okay? So that your competency will improve. So write down the hedging word identified in the questions. Arrange the hedging into 4 columns. Then confirm 1 to 7 answers. Locate the answers. Write the answers in a answer booklet. proofreading, fill the self-assessment form. Okay, this proofreading is very, very important. Okay, after finishing your 20 questions, you need to check your answers, whether you have written the correct answers, the spellings are correct or not. Because we may think like, okay, my answer is correct, but if there is a spelling mistake, they will consider that as a wrong answer. So be careful when you write your answers. Okay, you just copy and paste the answers on your answer booklet. Please be careful when you are doing that. Okay, then fill the self-assessment form. We have self-assessment form. We are posting daily it in our main Telegram platform. Please take the printout, and when you are doing your part A, please write your scores on your self-assessment form so you can self-assess your competency. Okay, this is today's topic. Okay, malaria in pregnancy. So your text will be like this. Okay, text A, text B, text C, text D. You will have 4 text. Okay, text A, text B, text C, and text D. Now I told you, you need to skim for your clues. Okay, when you will skim, these are the things you need to underline. Malaria, it's the name of disease, right? Then Africa, Asia, Latin America, names of a country, right? Of the countries. So that you can underline just when you will skim, whatever you are just seeing, okay, you can just mention. So Anopheles mosquito, it's the name of a mosquito. Then main species, 5 main species, it's a number. Then name of the species, malaria parasite, they have mentioned that you can just underline. Then here number is there, okay, 1981. Then North Queensland, it's a place. Hypoglycemia, it's a condition. Acute respiratory distress syndrome, it's a medical condition, plus abbreviation is there, you need to underline. Then here they just mentioned complications, some complications they have mentioned here. Then pregnant woman, okay. Then infectious disease specialist. Then travel medicine doctor, chemoprophylaxis agent. Okay, fine, enough. I'm not saying whatever I have said you need to underline. Whatever you feel it is important, you can underline according to our criteria. Okay. Then you can move to next text, text B, clinical symptoms of malaria. So in text A, what name we can give? It's like a description, right? Regarding malaria, the 5 main species they have mentioned. Then they have mentioned regarding the complications. Okay. So in complication, they just regarding the maternal complication and the neonatal complications. So these are the things they have discussed in this particular paragraph. So you can just give a description, okay, including complications. Overview. Yeah. Text B. Yeah, it's all depends on you, your flexibility. You can name it whatever you feel comfortable. Okay. Then text B is clinical symptoms of malaria. So it's the symptoms, right? So no need to read completely. You can just have a look like, okay, these are some symptoms: fever, headache, abdominal discomfort, all those. Then may present respiratory or gastrointestinal illness. Then incubation period they have mentioned here. So 95% percentage is there. Then 1 month time period is there. Then incubation period depends on the species. According to the species, the incubation period may vary, okay? So 9 to 14 days, then 12 to 18, 18 to 40, 9 to 12. These are some time expressions. Okay. Here, then again, fever. It's again symptom. Okay. So completely you can just name it as clinical symptoms and incubation period. Okay. Symptoms and incubation period you can just name. Okay. Then here text C, it's laboratory diagnosis for malaria. So laboratory diagnosis you can take as the name, because here they have mentioned regarding the blood smears, then stain, Romanowski stain, earlobe, culture. Okay, then heparin, EDTA, infants, heel, it's a body part. Just have a look, that's it, okay. Then 12 hours, okay, time period. Then 12 to 24 hours, again, they have mentioned in a febrile patient. That means that the patient have fever. Then rapid diagnostic test, okay, again an abbreviation, and it's the name of diagnostic test. Okay, then malaria antigens, fine. Then here they have mentioned many tests, okay, laboratory test like CBC, complete blood count, urea, creatinine, electrolytes, liver function test, serum glucose, venous pH, serum lactate, and coagulation studies. Okay, no need to read completely. You can just have a look. Okay, so it's a laboratory diagnosis here. Or lab investigations you can call. Okay. Now, text D, severe malaria in pregnancy, uncomplicated malaria in pregnancy. And here they have mentioned first trimester, second and third trimester. Here, artesunate 2.4 mg per kg IV. So it's a medication, right? So no need to read completely. You can just go through this. You'll understand like it's a treatment. Okay. All medications name they have mentioned here. Fine. So what is the sequence here? It's a description, including complications. You can write. Okay. So once you understood regarding the sequence or focus, what you need to do is in your text booklet, you need to write this in this way. In your text booklet, not in your answer booklet. Okay. In your text booklet, you can write this because you will get two booklets. One is your text booklet and the other one is your question and answer. So in your text booklet, you can write this description, arrow mark, okay, then symptoms and incubation period, then laboratory diagnosis and treatment. So when you will go read the questions, what you need to do is you can just see this, okay, and you can find out from which text it is. Now we can move to the questions. So here we have 15 minutes time, only 15 minutes time, but as an Edu Skill aspirant, you have only 12 minutes time. You have to think like that, okay? When you will practice also, you can just keep 15 minutes time, but always make sure you are completing within 12 minutes. And it may not be possible in your initial days of practice. It may take time, okay? So please be patient and do consistent practice. So here, look at the four text A to D in the separate text booklet. For each question 1 to 20, look through the text A to D to find the relevant information. Write your answers in the spaces provided in this question paper. Answer all the questions within 15-minute time limit. Your answers should only be taken from text A to D and must be correctly spelled. Okay, fine. So here you see, for each question 1 to 6, decide which text A, B, C, or D the information comes from. So you need to write only the text name, okay, A, B, C, or D. And you may use any letter more than once. That means sometimes for two two questions, your answer will be B or C. For 3 questions, your answers will be A. It may be like that. Okay. Yeah. So when you will do your skimming, you need to take only 2 minutes for your skimming. Okay. That means 30 seconds for each text. Fine. And 1 to 6 questions. Sometimes it will be 1 to 7 questions. So it will take only 1 minute or 1.5 minutes to complete these questions. Fine. Hope you will have the printed materials with you. Those who have printed materials, you can take that printed materials. If you don't have, you can just go through the slides. Okay. So are you ready to do this text?
Yes, ma'am.
Yes, ma'am.
Yes.
So
we'll start. Okay. Okay. So how to collect samples for
Analysis. It's C.
C, ma'am.
C. Laboratory and diagnosis.
Okay. So collect samples.
C.
Okay.
C.
You can just write your answers in a piece of paper. Okay. So first question, you need to write your answers in a piece of paper or on your book. No need to say the answers now. We'll check the answers later. Fine. So I'll show you how to complete these answers within a minute or 1.5 minutes. Is that fine?
Yes, ma'am.
Thank you. So yes, first question, how to collect samples for analysis. Regions of the world where malaria is endemic. You can write your answers. Then how long it may take for an infected patient to feel unwell. So the sequence is here. You can just see and write your answers. Then treatment for pregnant malaria patients. Treatment for pregnant malaria patients. Then the 5th question, who to contact for advice on preventive medications? Who to contact for advice on preventive medications? The sixth question, how malaria enters the body. Hope you have finished. Can I move to the next part?
Yes.
Yes, thank you. Okay, here answer each of the questions 7 to 14 with a word or short phrase. Okay, so each answer include a words, number, or both. Okay, seventh question. How long does a blood sample remain usable for diagnostic purposes? Here you can just say from which text it is. No need to write the answers. Okay, you can just write from which text it is, because those who don't have the printed material, it will be difficult. Okay, so you can just write the text, whether it is from text A, text B, text C, or text D. Then what is the ideal part of a newborn baby's blood for collecting a blood sample? Done?
Yes, ma'am.
Okay, what method of taking blood should be used if a sample is to go into a tube with EDTA? Very easy to find out the text. Those who have doubt, definitely I'll explain. Then 10th question, what should be added to the blood films to aid diagnosis? 11th one, which medication is contraindicated during the later stages of pregnancy? Then 12th one, which species of malaria parasite may have an incubation period of over a month? 13th one, among the complications resulting from malaria in pregnancy, which condition may affect both mother and infant? From which text it is? Which is the most dangerous species of malaria parasite for humans? Can I move to next session?
Yes, ma'am.
Thank you. So here in 15 to 20 also, you can do the same thing only. You can just write the text, okay? So if a pregnant woman who has been to a tropical region of Africa presents with a dash, she should be tested for malaria. You can write the text, which text it is, whether it is A, B, C, or D. 16th one, malaria patients may have symptoms of illness affecting their breathing or dash functions. Malaria patients may have symptoms of illness affecting their breathing or dash functions. 17th one, malaria antigens in a patient's blood can be detected by means of a dash. From which text it is? Malaria antigens in a patient's blood can be detected by means of a dash. Okay, then 18th one, when considering malaria test should be carried out to determine how well the patient's dash is working. Test should be carried out to determine how well the patient's dash is working. Yes. The 19th one, in severe cases of malaria in pregnancy, the woman may die as a result of low blood sugar and dash. Then the last question, patient should receive their third dose of artesunate dash hours after admission. Hope it is finished, right?
Yes, ma'am.
Yes. Now we'll move to the first question. How to collect samples for analysis? Okay. Collect samples, where it is? For the laboratory diagnosis only we'll collect the samples, right?
C. Or C.
Yes.
C.
See here, blood specimens can be taken directly onto a slide from a finger or an earlobe or by venipuncture into a tube containing an anticoagulant such as heparin or EDTA from infant's blood is best obtained from the heel. So how to collect? Here they have mentioned, right?
Yes.
Yes. So when you will read the question, your key word or the key phrase will be a synonym of your sequence. See here, laboratory diagnosis, it is mentioned, right? So here they asked how to collect samples. For the laboratory diagnosis only, we need to collect the samples, right? So our answer is C. Next question, regions of the world where malaria is endemic. So regions. You can say the answers now.
A.
A.
Text A. Yes, why? Malaria occurs mainly in the tropical areas of Africa, Asia, and Latin America. They have mentioned clearly because it's a description in when we read text A, we have read regarding the places, right? The tropical regions, Africa, Asia, Latin America. So the text A. Then, how long it may take for an infected patient to feel unwell?
Text B.
B.
Why?
C.
Symptoms and
Because of symptoms mentioned in
Yes.
text B.
And incubation period is mentioned
An
in text
incubation
B.
period is mentioned.
Yes. So here they have mentioned how long it may take for an infected patient to feel unwell. That means what?
Incubation
Incubation
period.
How long it will
Develop
take
symptoms.
Time
a patient
period. Time
to
To
show the
develop
symptoms,
time
right?
period to develop the
Time
symptoms.
phrase.
Yes. So when the symptoms will be visible or when can we find out the symptoms? Okay, this is malaria. So they have asked regarding that, how long it may take for an infected patient to feel unwell. That means when we can find out the symptoms. Okay, so symptoms it is. So from text B, here they have mentioned 95% of malaria cases develop symptoms within 1 month. So how long it will take? 1 month. So our
1
answer
month.
is text B.
B.
Then we'll move to next question. Treatment for pregnant malaria patients. Treatment
D.
where
D.
we have read. Yes,
D.
D.
it's D. No doubt, because here
D is written. Treatment in the D.
yes, treatment is written. Next question. Who to contact for advice on preventive medication? Because when we
Medical
will
officer. Consult medical officer.
So question number 5, who to contact for advice on preventive medication? So who to contact
D.
for preventive medication means what? The synonym what they have used here in the text is what? Can you find out the word? Preventive medication.
Prophylaxis agent.
Sorry.
Prophylaxis agent.
Yes,
Prophylaxis agent.
chemoprophylaxis agent.
Prophylaxis.
The other name of preventive medication,
Chemoprophylaxis.
synonyms. Okay. So who to contact? They have mentioned here who to contact. So travel medicine doctor to determine the appropriate chemoprophylaxis agent. Okay, infectious disease specialist or experienced travel medicine doctor. So your answer is A. Then next one, how malaria enters the body. From where it will be? From the description, right? Because here mentioned malaria is the parasitic disease spread by the bite of the female Anopheles mosquito, which result in infection of a red blood cell. So our answer is text A. So you need to write A. We'll move to next session. Okay. One word or phrase you need to write. So here in question number 7, how long does a blood sample remain usable for diagnostic purposes? So here it's mentioned diagnostic purposes. So from which text it is, you need to identify from which text it is. First you need to,
C.
yes.
C.
Text
Yes, identify the keyword or
C.
key phrase. Then you need to identify the text. So we identified the text as text C. We need to search for the answer now. So how long? You need to find out how long does a blood sample remain usable for diagnostic purpose. So here, blood specimens older than 12 hours should be rejected. It's a paraphrasing, right?
Yes.
Yes. That means you can use within 12 hours. Then after that, we can't use, right? The same statement they have mentioned here, but they have paraphrased. Blood specimens older than 12 hours should be rejected. That means it remain usable for 12 hours, right? Yes. Then 8th question, what is the ideal part of a newborn baby's body for collecting a blood specimen? So we identified the key phrase, okay, collecting a blood specimen. So where it is collecting the blood specimen for what? Laboratory diagnosis, right? Yes, C, text C.
C.
Yes, here from infants, that means newborn, right?
Newborn baby.
From infants, the blood is best obtained. That means ideal part, so best obtained. From where?
The heel.
The heel.
Heel.
So you need to write the heel. Okay.
Can I write heel only or the heel we have to write?
The heel you need to write because it's a body part, right?
Yeah.
Yeah, you need to write the heel. Then what method of taking blood should be used if the sample is to go into a tube with EDTA? And one thing you need to remember, if here the is not there, no need to write. Okay, here the is there, so you need to write. Copy and paste. Okay. Okay, next question. What method of taking blood should be used if the sample is to go into a tube with EDTA? So, method of taking blood. From which text it is?
C.
Yes,
C.
it's C. Because for the laboratory diagnosis, we will take the blood samples, right? Then we need to find out what method. If the sample go into a tube with EDTA, then what is the method they are asking? So in text C here, you can see blood specimens can be taken directly onto a slide from a finger or an earlobe or by venipuncture into a tube containing an anticoagulant such as heparin or EDTA. They have not mentioned here an anticoagulant such as heparin. They directly said like this, into a tube with EDTA. Containing EDTA, right? If the tube is EDTA, then the method is like venipuncture. Hope it is understood. We'll move to next question. Question number 10. What should be added to the blood films to aid diagnosis? Again, from which text it is?
C.
Yes, it's C. So here you can see they should be stained. Okay. They should be stained because they have mentioned here both thick and thin blood smears should be prepared. Then they should be stained with a Romanowski stain so as to maximize the occurrence of diagnostic criteria such as stippling on the infected red blood cell. So what diagnosis they have asked? Films. Okay. What should be added to the blood films? Here blood smears they have mentioned. Here blood films they have mentioned. Both are same. So what we need to add? The name of the stain, right? Romanowski stain. So your answer will be right. Please copy and paste your answers. That means you need to see this, then you need to copy it. Don't make spelling mistakes, okay? Whatever, if you know the spelling also, when you will go for your exam, when you will write your exam, please see that and write. Even if it is a symbol like paracetamol, we will think like, okay, we are working as a nurse for like 10 years, 20 years. But in exam tension, we may have some like, make some spelling mistakes, okay? So please be careful. Otherwise, they will consider that as a wrong answer. And you will think that, yes, any doubt in this question?
Can you explain one more time?
Yeah. What should be added to the blood films to aid diagnosis? Okay. So this topic is from laboratory diagnosis. That you understood, right?
Yes.
Okay. So here they have asked what should be added. Something you need to add in this blood smear or blood film. Okay. Here they have mentioned blood films, but here they mentioned as blood smears. Okay. So when you will do this, you need to add something. They have mentioned here they should be stained. They should be stained means you need to add something here. With what? Romanowski stain. Okay. Romanowski stain you need to add so as to maximize the occurrence of diagnostic criteria and stippling on the infected red blood cell. They have asked only this one, right? What should be added to the blood films?
Okay.
Understood? Yeah.
Yes.
Yes. So we'll move to next question. Which medication is
Can we write A? A, Ravanski. So can we write A?
No need. You can write what they have asked, what should be added. No need to write A, Romanowski stain. We used to write Romanowski stain, right? No need to add A.
Okay, ma'am.
Because here it's a question answer type, no? So no need, because they asked the name of that, right? What should be added? So no need to write A. Okay, so 11th question, which medication is contraindicated during the later stages of pregnancy? So medication, which text it is?
D.
Text D. Now you need to see contraindicated during the later stages of pregnancy. Okay. So contraindicated during the later stages of pregnancy. Later stages of pregnancy means what here? Second and third trimester. That is our yes, later stages of pregnancy, right? So what is contraindicated? Which medication is contraindicated? They asked regarding that. So here you can see, so in second and third trimester, that is later stages. So we need to look into that part. So IV quinine should be avoided. That means it's contraindicated. You're not supposed to use this, right? Should be avoided as it is associated with a recurrent hypoglycemia. If you use this, then the patient may face hypoglycememia, right?
Yes.
So your answer is IV quinine. Next question, 12th one. Which species of malaria parasite may have an incubation period of over a month? So incubation period you have here. So you need to move to text B. Then you need to see which species of malaria parasite may have an incubation period over a month. So you need to see more than 30 or 31 days you need, right? Over a month means. So here days already you have underlined, right? So you can see 9 to 14, 12 to 18, 18 to 14, 9 to 12. So which will be your answer? 18 to 40 days, right? That is more than over a month. So P, malaria is your answer. Then 13th question, among the complications resulting from malaria in pregnancy, then complications, you have a word here, keyword. So you need to move to which text?
A.
A. So what do you need to find out from this question? Okay. So here, which condition may affect both mother and infant? Not only mother, not only infant, both. Okay, both mother and infant. So here in text A, complications, the word is there. So you can just directly move there and search for your answer. The main complications are miscarriage, stillbirth, preterm birth, low infant birth weight, severe maternal and neonatal anemia. So these are like miscarriages for mother, right? Stillbirth, preterm birth, low infant, that is for baby, right? Then here only severe maternal and neonatal anemia. That means mother and baby will have anemia, right? Okay. So the main complications are what? One of the complications is severe maternal and neonatal anemia. That is, here they have mentioned mother and infant, but in your text they have mentioned maternal. That means mother, and neonatal. That means infant. So your answer is anemia. We'll move to next question. 14th one, which is the most dangerous species of malaria parasite for humans. Okay. So most dangerous species of malaria, where we have read regarding that in text A, right? 5 main species of malaria parasite infect humans. Plasmodium falciparum, the severest form. See here, the severest form. That means most dangerous one, right? They used the synonym. So your answer will be Plasmodium falciparum. So when you will write, please check your spellings, okay? Can I move to next one?
Yes.
Yes.
Okay, thank you.
Yes.
So 15th one, if a pregnant woman who has been a tropical region of Africa presents with a dash, she should be tested for malaria. I think you will be confused with text A and text B, right? Because here tropical region of Africa is there, correct? So from which text it is? Text B, right? Yes. Why? Here they have asked presence with a. That means a symptom, right? Presence with a what? With a something, some symptoms, okay? So you need to see she should be tested for malaria. Here you can see malaria should be considered in pregnant woman, okay? with a fever who have traveled to malaria endemic areas. Malaria, one of the malaria endemic area is Africa, right?
Yes.
Yeah, so here malaria should be considered in pregnant woman with a fever. So with A, till here it is there, okay, with A, presence with A, so with A, fever. So you need to write here fever, who travel to malaria endemic areas. That means she should be tested for malaria here. They have mentioned malaria should be considered. Hope it is understood. We'll move to next one, 16th question. Malaria patients may have symptoms of illness affecting their breathing or dash functions. So here symptoms is there. So which text it will be?
To be.
Text B.
B.
So in text B, you need to see illness affecting their breathing or dash functions. Okay. So here may have, may present. Okay. Synonyms they have used like may, present, have. Instead of present, they used here have. Then symptoms is here. Okay. So as a respiratory. Okay. Breathing means what? It's a respiratory
condition.
Yeah. Yes. So breathing, instead of breathing, they have mentioned here respiratory or is there. Then gastrointestinal illness. Okay. So here they have mentioned illness affecting affecting their breathing or gastrointestinal functions. So here gastrointestinal is there. You need to write here gastrointestinal. Okay. Then we'll move to next question, 17th one. Malaria antigens in a patient's blood can be detected by means of a dash. So from which text it is? Patient's blood can be detected. So yes, laboratory diagnosis. So here you can see malaria antigens. You can just take that phrase malaria antigens. You can just, because here regarding the blood smears, they have mentioned blood specimens, everything like anticoagulant. Then for a febrile patient, what you need to do, then here malaria antigen should also be requested. So malaria antigens is here, the word, same word is here. So you can just see what by means of a what test. It's rapid diagnostic test. Yes, should be there. Okay, yes, sorry, S must be there. If you're not writing this S, then your answer will be wrong. So please be careful, okay, when you will write. Then 18th one. When considering malaria test should be carried out to determine how well the patient's dash is working. When you will read the question, you will understand test word is there. So definitely it is from the laboratory diagnosis. Then how well the patient's dash is working. Then definitely it will be a body part, right? Patient's dash is working. So you need to see here. Other tests should include complete blood count, urea, creatinine, electrolytes, liver function test. That means what? You need to know how your liver is functioning, right? How it is working. Then serum glucose, venous pH, serum lactate, and coagulation studies they have mentioned. So what is your answer here?
Liver.
Liver, because here liver function test, you need to know how your how the liver is working. Liver function test, what is the value for that? You need to check. So liver is your answer. Liver is working. 19th one. In severe cases of malaria in pregnancy, the woman may die as a result of low blood sugar and dash. So in severe case of malaria in pregnancy, so which text it will be?
Yeah.
Yeah, because it's a description, right? So here, in severe cases of malaria in pregnancy, the woman may die. That means the pregnant woman, right, may die as a result of low blood sugar. So here you can see severe malaria may lead. Okay, the same word, modal verb they have used, may. Okay, may lead to fetal loss and high maternal mortality. Okay, high maternal mortality. High maternal mortality means what? Here, woman may die. That means the pregnant woman, right? In severe case of malaria in pregnancy, they have mentioned. So the pregnant woman may die. That means maternal mortality. Okay, due to what? As a result of. Due to means as a result of. Hypoglycemia. Hypoglycemia means what? Low blood sugar, right? And what? Here they have mentioned acute respiratory distress syndrome. So acute respiratory distress syndrome is your answer, right? So they just paraphrased sentence. Severe malaria may lead to fetal loss and high maternal mortality due to hypoglycemia. Hypoglycemia means low blood sugar. Maternal mortality means the pregnant woman may die. Okay, so that's a maternal mortality. So 20th question. Patients should receive their third dose of artesunate dash hours after admission. So third dose of artesunate, that means treatment, right? Text D. Here you can see in first trimester. Artesunate 2.4 mg per kg IV on admission. That means on admission means first dose, right? And repeat after 12 hours. That means second dose. And 24 hours. That means the third dose. So when a patient will get admit, then you need to give the medication on admission 12 hours, then 24 hours. That means the third dose is at 24 hours, right?
24.
So your answer will be 24. So thank you. Now, if you have any doubts in any question, you can ask. If you want
Yes,
to
ma'am.
revisit any slides, you can ask
Previous
now.
question, the liver was there. So can we write a liver function, ma'am?
No, because it's already mentioned right there. They asked patient's dash is working, liver function is working, whether you will say like that. We'll just write the name of the body part only, right? I'll show the questions here. See here. When considering malaria, test should be carried out to determine how well, okay, how well the patient's dash is working. That means the function of that body part. So you need to write only that body part, liver. That organ you need to write. No need to write liver function is working. Will not say right like that because it's already in there in the question.
Ma'am, I have a question regarding question number 13. Can we move to that slide from text A?
Yeah. Among the complications resulting from malaria in pregnancy, which condition may affect both mother and infant? They asked which condition affect both mother and infant. So your question is here, doubt is here, right? Severe malaria may lead to fetal loss. Okay, fetal loss is for mother, right? And high
Yes, ma'am.
maternal mortality. It's not for affecting like for the mother and infant. It's after the delivery, right? Maternal and neonatal anemia.
Okay, ma'am. Okay, ma'am, I got it. Okay, thank you, ma'am.
You understood? Yeah.
Yeah,
Thank you. So any other questions, any doubts in this topic? Otherwise, I will stop, share my screen.
Ma'am,
14th question slide.
timing
Sorry?
means
14th question slide.
14th question. Which is the most dangerous species of malaria parasite for humans? Okay, so here species we have mentioned, we have read here in your text A, 5 main species. Okay, you need to see most dangerous one. So here Plasmodium falciparum, the severest form they have mentioned, right? This all for human, in fact humans only, but the severest form, that means the most dangerous one. Understood?
Yes, ma'am. Thank you, ma'am.
Thank you. You're
how many
welcome.
can we take for the skim and scan? Because 15 minutes only.
Yes, as I told you before, 2 minutes for your skimming. Okay, that means for each text you will get 30 seconds time for your skimming. Then for question 1 to 6, you can take 1 or maximum 1.5 minutes. If you know the sequence, definitely it will not take more than that. Okay. Then after that, 7 to 14, you can take 3 to 4 minutes time. Okay. Again, 15 to 20 also 4 minutes time, because where we will take more time to identify the text, right? If you know the sequence, if you are writing your sequence in the text booklet, okay, see it's like this. If you are writing like this in your textbook, or no need to write this much, you can just write description, symptoms, in then laboratory diagnosis, treatment in short form. You can just mention in your text booklet, so that it will be very easy to identify the text. Most of the students, they will take time to identify the text. They are in confusion whether it's from text A, text B, text C, or text E. from which text it is. They will take time to find out the text. So if you know the text, then you can just go to that text, like you can just search in only that particular text. Otherwise, what you will do, you will search in every text, whether it is A, B, C, D. You will take one word and you will find in all the text. Correct. You will search in all the text. So see, the reading part A is very simple, okay, very easy, because if you know the sequence, you can just read the question. You need to identify from which text it is. Directly, you can go to the text and find out the answer. It's not like you need to read the question, understand the question. That's a simple thing, okay, because answer is there. Your question will be like indirect questions, but your answer will be direct from the, it will be the direct answers. Okay, they will not ask the questions directly. It will be like, they will use the synonyms, they will use the, they will change the sentence. Okay, they will just paraphrase it. They will use synonymous language. But otherwise, the answers will be same. You can just copy and paste. So 2 minutes for skimming,
But once we are
1.5
using
minutes
the
for your
synonyms-
1 to 6 question, 7 to 14, you can take 4 minutes time. Again, 15 to 20, you can take 4 minutes time. So total 12 minutes time and 3 minutes for your proofreading. That means you need to check whether you have written all the answers. You need to check whether it's in the correct place, your first question answer in the first question's place, or it is in the second question's place, because in tension, exam tension, we don't know what we will do. Okay, so if you are competent and confident, definitely the tension will not be there. If you know the strategies, what you need to do, definitely the tension will not be there. But if you don't know, if you're not following the strategies, if you are not practicing consistently, definitely the tension will be there. So you can use these strategies, practice consistently, okay? It is very important.
Does this sequence will applicable for all kinds of part A or reading? Any?
Yes, sequence means sequence will definitely change. You need to read and find out the sequence. Some text you will not have any headings, so you need to read the first sentence of that particular topic, paragraph, okay? Then you need to understand, okay, from the sentence, you will find out what is the topic they have mentioned in that particular paragraph. And one important thing is, when you will feel like, you can just take 30 seconds for a question. If you're feeling like you are not able to find out the answers to a particular question, please skip that question and move on. Okay, please don't wait. Okay, don't search for the answers for 1 minute, 2 minute, 3 minute. Only 30 seconds time for each question. You can read. If you're not able to find out the text, or if you find out the text but not able to find out the answer, please skip that question and move on. Later you can find out the answers. Okay. Otherwise, the balanced questions, you will not get time to complete it.
What about
Fine.
capital and small letters, ma'am?
Yeah. See, whatever is there in your text, it's always safe is whatever is there in the text, the same thing you need to copy, because it's copy and paste, right? When you will copy and paste a word, the same thing will come, right, on the next side. So it's so simple. Whatever is there in your text, you can just copy it.
Hello.
Yes, Padma Priya.
Yes, ma'am. Good evening. Glad to
Good
meet you, ma'am. This is the first video session I am attending. Before I was attending with fathers one, and today I really am lucky to attend this class.